And here we are again. Good morning and welcome to our web show. It's All in Your Head. My name is Rita. I'm the moderator, and we are here today with Dr. Paul Swingle to talk about age-related decline. Yes, as we get older, our supply of brain cells is getting down to manageable size, and that, of course, has certain effects. Now, before we get to it, let me tell you something about Dr. Swingle. Dr. Swingle was titular full professor of psychology at the University of Ottawa prior to moving to Vancouver. Fellow of the Canadian Psychological Association, Dr. Swingle was lecturer in psychiatry at Harvard Medical School, attending psychologist at McLean's Hospital in Boston, where he also was coordinator of the clinical psychophysiology service. Dr. Swingle is registered psychologist in British Columbia, certified in biofeedback and neurotherapy. His newest book, Biofeedback for the Brain, was published by Rutgers University Press. The book is available at www.soundhealthproducts.com. Again, that is www.soundhealthproducts.com. Also, I'd like to encourage you to send us your questions at any time during this webcast through the chat feature on your control panel. We will have 2 breaks in which we will be answering your questions. And without further ado, here is Dr. Swingle. Good morning.
Okay, so the topic today, folks, age-related decline, a topic that I have particular interest in, as many of you may know, in terms of my age. So it's a topic of very great interest. Now, the first thing is it sounds ominous when we say age-related decline. And what we're going to be talking about today are the various kinds of conditions that affect our cognitive functioning and the sorts of things that we can do about it. Factors in age-related decline. The first is genetics. If your Uncle Charlie lived to 100 and your Aunt Jane lived to 95, then you've got some good genetics. You've got some good genes floating around. So that is part of the equation. Now, there are a lot of other things associated with this, and we're going to be talking about a lot of them. We're going to be talking about your life experiences and how that may impact the aging process. Trauma is a big one. Individuals who have been through severe emotional trauma, very often there are conditions that can accelerate some of the age-related issues, and we'll talk about those in some detail. The other is what I call dis-ease. Now, we're going to be focusing a lot on the emotional side of things. Conditions like stress, conditions like social support, conditions like your living environment, and then, of course, you have issues associated with health. Now, you'll notice that the largest font that I used in this slide is for activity. The bottom line is, if you don't use it, you're going to lose it, period. And we're going to be spending a huge amount of time talking about some of the factors associated with how do you keep yourself mentally and physically active. This just came out a week or so ago in the journal Neurobiology of Aging. It was a researchers. I was trying to think of where they're from. I think it was NYU, but I'm not sure of that. In any event, they were looking at the impact of salt intake and inactivity on cognitive functioning. And what they found, of course, is that very high levels of sodium can have a negative effect on cognitive functioning. But it is exacerbated by a lack of physical activity. They studied quite a few folks there, as you can see, 1,200 older adults with normal cognitive functioning. And they found that high intake of sodium combined with low levels of physical activity was associated with decline in cognitive functioning. However, what they found, and this we find over and over and over again, is that moderate exercise may essentially immunize the brain against the adverse effects of higher sodium. Doesn't mean you should exercise and then go out and eat a lot of potato chips. That's not what it's saying. And obviously exercise and reducing sodium intake is the best of all combinations. But the point I'm really trying to drive home here is that if your image of getting old gracefully is sitting in a rocking chair and watching TV, you're in for very, very serious consequences associated with that. The activity again, we're talking about action, movement, motion, bustle, hullabaloo, commotion, doings and goings on. This is just the thesaurus out of Word. But the point is, keep the mind and the body active. Now we're going to be talking about 5 very specific areas in the brain. We're going to be talking about the frontal region in the brain, the executive portion in the brain. We're going to be talking about the areas over the sensory motor cortex, and we're going to be talking about areas in the occipital region in the brain. Now, there are a lot of things that can affect the aging process. Some conditions give rise to just feelings of despair, lack of interest in things. And if you lack interest, you lack motivation. You lack motivation, you're not active. So we will be concerned with issues like problems with sleep, problems with depression, problems with anxiety. That's what I mean by the dis-ease component that I was referring to earlier. We're going to be looking at raw data from clients, and just so you get an idea of what this looks like, this is a client, and what we're looking at here is I was measuring right up over the sensory motor cortex, remember, right in the center of the brain, and I'm measuring in the back of the brain, and I'm measuring over the right front part of the brain, the left front part of the brain. And you can't see it now, but this is a client who has severe predisposition to depression and a marked elevation in emotion, in conditions that give rise to emotional volatility. Okay, and I'm going to be using summaries, so the summary looks something like this. And what I was referring to before in terms of the depression is reflected here in imbalance between the front part of the brain, and the emotional volatility here is another imbalance in the front part of the brain. Now, I'm just showing you that we have a lot of data, so that what we're going to be talking about is data-driven. We know what the neurology should look like. We know what the neurology looks like of a client who walks in the door. And then we can correct and modify and improve the conditions, and then we can work with preventing and immunizing against rapid or accelerated cognitive decline. We have lots of different ways of representing our data. This happens to be a topographical representation, and I've shown this before. This is a marker for depression, in which this is the left side of the front part of the brain.